What I've learned about the landscape of grief and drug poisonings during the pandemic is, in my experience, it has created additional stigma and this strange sense of which kind of loss deserves to be mourned or prevented or honored. Um, I have heard a lot of arguments that say things to the effect of, you know, we can't get PPE, but we can get harm reduction to folks. Like, why are we spending our money the way we're spending it? Um, and that's been really tricky. I think it's caused a lot of people to grieve quietly and privately, where they would benefit from being in community and having support and being able to seek support. I also have uh, spent a lot of time doing rounds in the hospital to get referrals and recognizing the terrible state of our public health system and knowing that when I'm in that hospital, there are deaths that are happening that could be triaged differently if we had the appropriate support for our hospital and funding in our hospitals, or even hospital visits that would be prevented if we had the right supports at a community level. And so I think throughout the pandemic, a lot of folks that are on the front lines of this or in the community during this are experiencing a disproportionate level of anger in their grief because it's avoidable.